MB News. Today we're thrilled to dive into a conversation that's reshaping the future of cancer care, the rise of integrative oncology, bridging cancer treatments with holistic care. I'm Emilia Lujan, your host and the founder of Mindful Body Productions, a purpose-driven digital marketing agency dedicated to elevating healthcare brands and sparking meaningful change in consumer culture. At MB News, we're passionate about fostering a holistic approach to wellness, making it easier for both practitioners and patients to really thrive. And for those of you joining for the first time, welcome to our community. Here at MB News, we are committed to bringing you transparent insights into the health and wellness landscape and sharing uplifting stories that are empowering humanity. While the news often focuses on the challenges, our goal is to illuminate pathways to growth, healing, and transformation, backed by both expertise and empathy, of course. Join me in today's discussion are two incredible speakers whose personal and professional journeys bring unique perspectives to integrative oncology. First, we have Lesley Nygaard, a breast cancer survivor and thriver, turned naturopathic nutritionist. We also welcome Mark Brown, an oncology nurse with years of experience helping patients navigate their treatments. Together, Lesley and Mark co-founded Dermavitality, a brand that champions integrative solutions, offering topical products to support cancer treatment journeys. We're honored to have both of them here today, sharing their insights, stories, and actionable strategies. All right, let's get started, and a warm welcome to everybody tuning in from across the web. We are thrilled to have you joining us. We are welcoming currently just about 227, 9 people. Amazing, thank you. Welcome everybody. If you're joining in for the first time, welcome to our community once again. First and foremost, I'd like to introduce Lesley Nygaard. Lesley was diagnosed with stage 3 hormone receptor positive breast cancer in March of 2009 at the age of 41. As a BRCA2 positive individual, she underwent chemotherapy, radiation, and more than 10 surgeries related to her cancer treatment. In 2024, she proudly celebrates 15 years of being cancer-free. And as a naturopathic nutritionist, Lesley adopted an integrative approach to her cancer treatments and recovery. She was inspired by her own journey, and she co-founded Dermavitality with Mark Brown with the mission to make a difference in people's journey and make their journey within cancer treatment a little easier by providing effective natural solutions for skin issue related to radiation and chemotherapy. So welcome, Lesley. Thank you so much for joining.
Thank you for having me, Emilia. I really appreciate this opportunity.
Fantastic. I'm so happy to have you. I do have a first question for you. Why do you think this topic is important for consumers?
I think it's important because when you're diagnosed with cancer, so many things feel out of your control. And when you use an integrative approach to your treatment, combining holistic modalities along with traditional therapy makes you feel more like you have an active participation in your cancer treatment. And it makes you feel a little less out of control, or that things are happening to you and that you get to be involved in the actual process of your treatment.
Certainly, I definitely agree with that. It's so empowering to take your health into your own hands as well, along with having, complementary treatments and the treatment that's given to you by your doctor to ensure that you have a safe and effective recovery. And we've known each other now for a couple of years, and it's been really inspiring to see the journey of your brand in the short amount of time, even in reflection to how my uncle had such a powerful experience with your topical creams. So it is very empowering to see how you're making such an amazing impact in people's lives. And I'm so happy to speak with you today about this topic.
Thank you.
Amazing. Next, I'd like to introduce Mark Brown. Mark is a registered nurse who worked as an oncology nurse for 10 years and has over 20 years of experience in nursing. He has a bachelor's degree in nursing and co-founded Dermavitality with Lesley. During his career as an oncology nurse, Mark observed how an integrative approach to cancer treatments help patients maintain a better quality of life. He also saw the challenges patients faced in caring for their skin during treatment and noticed that there weren't any natural skincare lines specifically tailored to cancer patients' needs. So welcome, Mark. So happy to have you here today.
Thanks for having me. I'm honored to be here.
Amazing. A question for you, Mark. Why would you say this topic is important for healthcare professionals?
Well, I think integrative oncology is important to nurses and healthcare professionals because it really enhances patient care by combining conventional cancer treatments with evidence-based complementary therapies. Integrative oncology is different. It just addresses the whole person, body, mind, and spirit, and it helps manage side effects like nausea, fatigue, and pain. And it just brings in, a more holistic approach for the patient. Working together with your nurse and your doctor and your integrative oncology professional really can help make the journey a little easier, which is ultimately the goal for us.
Yeah, that's really important in that aspect of empowering oneself, as Lesley was mentioning. And this topic is actually very interesting to me because as a marketing expert and a media expert as well, our perception of illness and disease is really shaped by what we look at, what we're brought up with. So by what we're told as well by either, our medical providers or the mainstream media. So it's really interesting to see an evolution in this approach. And from a media perspective, I've really seen a shift in the way big pharma and conventional medicine is moving towards more integrative or holistic approaches because the consumer tendency is also there. And now many, many more people are seeking complementary ways to support their journey. So first and foremost, Lesley, can you share how your personal experience with cancer shaped your understanding of integrative oncology and its potential to improve patient care?
Absolutely. So I've always been very interested in this topic, even before I had cancer myself. And I definitely think there's plenty of evidence to show that when somebody is in a better frame of mind, they're more relaxed. There's cellular activity that happens when you're stressed and your cells actually die. So I think, when you're using aromatherapy or acupuncture or yoga or massage, things that just, reduce your stress and anxiety, you're going to have better outcomes in general because, people are just better off when they're relaxed and they're in a good frame of mind, and the goal is to get the whole person as calm and relaxed as they possibly can as they're going through this. And more people are looking at these and the outcomes are better. So it's just fundamentally the way that things are moving and the direction they're going. And I think integrative therapies didn't really hit the space until around the time that I was diagnosed. So that was really when integrative practices around 2009 started to really hit the mainstream, but they are so commonplace now that most cancer centers have additional services available for patients.
Yes, and it's really inspiring to see this evolution because it's very impressive from just the standpoint of health, how much stress does impact our well-being. And having cancer isn't something that's like, oh, everything's fine. Of course it's going to be very stressful on your body. You don't know how you're going to feel tomorrow. You don't know what's going to happen in a year or 2 years. So Mark, my question to you is, what are the most notable changes you've seen in the landscape of cancer treatment? How are these changes influencing the way oncology professionals approach patient care?
I think that, basically over the past few years is basically it's targeted therapy, it's patient-centered therapy, and it's a very targeted approach to chemotherapy, radiation therapy, with all the advances in the different genetic testing with tumor cells. The whole landscape is really going towards more of a customized approach and very targeted therapy. In addition, I think that the traditional Western kind of oncology practitioners are acknowledging, the addition of integrative oncology and a holistic patient-centered approach to care. And there's, good data now out there about how mindfulness practices, yoga, meditation, optimized nutrition can really enhance patient outcomes and also, help with the side effects, fatigue, all of that. A lot of cancer centers have foundations. They're, basically providing some of these ancillary services free of charge, exercise for energy, wigs, a massage, all of these things. I think that the traditional Western, kind of oncology practitioners are acknowledging how important it is to treat the patient holistically.
Yeah, certainly. That's very powerful to see that change in the landscape as well. And just how Lesley was saying when she initially, I think it was when you initially got cancer, this was just starting to, it wasn't even in the mainstream yet. So Lesley, what evolutions have you seen where wellness companies and healthcare providers are really playing and bridging the gap between traditional cancer treatment and holistic care?
Well, they've had peer navigators around for a really long time at most cancer centers, or nurse navigators that help people, navigate their entire process, lay out their treatment plan. I think if anyone's ever seen anything else that I've written or said in the past, one of the scariest points in the cancer journey is when you're first diagnosed and waiting to figure out what exactly your treatment protocol is going to look like. It's a very stressful time. And one of the foundations in naturopathic medicine across the board is to minimize any inflammation, because a body inflamed is a ripe area for disease to occur, including things like cancer, which is a mutation of cells. So I think you see more and more companies integrating aromatherapy. I mean, I think everyone's trying to be really careful about making sure that you're using very natural and organic products when you're in this space, because especially with certain types of cancer, they have hormone receptive qualities to them. So you want to be very careful what you're applying to your body. Mark teases me all the time because I say your skin is your largest organ. And so if you're slathering yourself in products that have parabens and phthalates that are hormone disruptors, that's absorbed into the bloodstream. So when you're managing these situations, you want to make sure you're putting really clean products on your body. And there was some data from a study in 2020 that said that people who used integrative therapies had a 95% reduction of side effects of the treatment. So we've come a long way. If you've seen old movies where you see a lot of people going through cancer treatment with a lot of nausea and vomiting, there's a lot of different ways to manage those side effects. And I think, again, when you're managing somebody's side effects and they're not suffering, then they're in a better frame of mind throughout the treatment process, which relieves stress, which reduces inflammation, which just all together leads to better outcomes. So I think you see more and more companies trying to incorporate that, and more nurse navigators and peer navigators, talking about the different kinds of things that you can do to help minimize stress and inflammation.
Wow, that's a pretty impressive statistic of how it really does reduce those side effects, because as we can see, just this past year, cancer is just continuously on the rise. So now at the forefront of the conversation is, how can we prevent this? And if you are a cancer patient, how can you overcome this with these integrative therapies? And really another interesting aspect of this whole movement and this conversation is that for centuries, ancient civilizations have known that the body has the natural ability to really heal itself, given, of course, the right conditions. And now in modern society, we're starting to adopt these concepts into mainstream. Of course, when we get to the point of terminal illness, external support is certainly necessary to balance the body. So my question to you, Mark, is what are some ways health professionals can better empower patients to take an active role in their healing journey?
Yeah, I think, it's about collaboration collaboration with your patient as like a nurse, because at the end of the day, like, you come in and get chemotherapy and you don't have a lot of choices. Here's your regimen. This is your radiation. This is what you're doing. And you don't get to participate in that like healing part of your journey. You know, this is what your oncologist says. He's trying to save your life. He's using very scientific principles to give you the best treatment to try to save your life. But there's not a lot of choices. So as nurses using integrative oncology, holistic practices, we can collaborate with our patients. We can empower them to make informed decisions and choices so that they can participate in their healing journey, whether it's nutrition, mindfulness practice, relaxation techniques, all of those things. So then they can actually feel like they're doing something about their cancer treatment and their healing journey. So I think it's really great for nurses to be able to collaborate in that way with their patients.
Yeah, certainly. And I do see a shift towards that and a tendency towards that as I've interviewed other healthcare professionals and doctors on the show, and also speaking to them just from my day to day. More and more doctors, nurses, healthcare providers are including a more collaborative approach to treating their patients' conditions and their patients' health challenges. So Lesley, I'd love to know, how does your brand's approach to topical products and supplements complement the integrative care model?
Well, I think, we haven't decided to go the route of a clinical trial. I think that and because we are an over-the-counter product, we are FSA and HSA reimbursable. It's kind of a physician by physician decision to use it. But we started out with a pretty big sample program, and we provided samples. And so what often happens is patients will come in and the oncologist will see, primarily I'm speaking about our radiation relief cream and radiation relief sprays. They just see that the patient's skin is holding up so much better than other people. And so they ask them what they're using. We always tell people to check with their radiation oncologist before using the product, but oftentimes people are so miserable, they might go to a website where there's other people going through treatment and ask what they've been doing and looking on, the internet just to get answers about what they think might help. And the results I think they even astonished us, to be honest. I mean, we knew that it was going to be a great product, but I don't think we knew it was going to do quite what it does. And for the people on the call that don't know, when you're going through radiation, it presents like a burn, but it's actually a form of dermatitis. And so the good news is that there's already been studies that if somebody has no interruption in their radiation treatments, they have better long-term survivability. And our brand does help the skin maintain so that they can have all treatments. There's different programs, but most people have around 30 to 36 radiation treatments 5 days a week for 6 or 7 weeks. And so again, if you don't have to have any interruption in that process, then ergo better long-term survivability. I mean, we can't make those claims specifically because we haven't done a clinical trial, but we do know that if somebody doesn't have an interruption in treatment, by utilizing our product, that it has a better long-term outcome. We have other products too, but that's the first thing that comes to mind.
Yeah, and I'm just very impressed by it altogether, because I saw firsthand how amazing it was in supporting my uncle's healing journey when he was going through his radiation treatment. Even my aunt was like, why aren't the doctors promoting this in the office? And she was just spreading it around, rubbing it on people. I don't know if she's allowed to do that, but she was so excited about it because he was feeling so much relief. And even, people that would go to the radiation, because you're surrounded in that space and you talk to a lot of people, they were really suffering. And my aunt was giving away that cream and buying more. I remember she was talking to you, Mark, and she was like, Mark, I need more samples. We need to, shout it out in the rooftops. So I think it's really exciting what you guys are onto, and definitely something that more and more people need to know about. And I haven't had any burn or radiation therapy therapy or any version of like dermatitis on my skin, but just from like feeling the radiation relief therapy, I think that's the one that has lavender. Is that right?
We have two formulas. I mean, we originally created one with lavender because it had been used on its therapeutic grade and it's only 1.1%. And it was not put in for the scent. It's the medicinal properties of the plant because it had been used on burns in France since the 1800s. But we did have a large number of radiation oncologists that felt pretty strongly that an unscented version was needed. And when we first introduced that to the marketplace, you know, we were very open with the physicians saying, you know, we don't know how much that, you know, 0.1% of lavender is contributing to the efficacy, but it's actually turned out to be just as effective in the unscented version. So we're happy to have both the spray and the lotion in unscented and the scented. And it's kind of an individual patient by patient basis, what they prefer, or if the physician really, you know, just doesn't want any kind of scent in there. So.
Yeah, that definitely makes sense. I've loved, like, I would spray it on my skin and really did feel how soft it was and saw even my uncle's progress with the cream. So it's just really fantastic to see more companies, more health conscious individuals wanting to take this holistic approach to optimizing their well-being. Now, Mark, from your experience, how can patients balance their use of conventional and holistic methods to really maximize their overall well-being?
Well, I mean, the first thing I think comes to mind is listen to your oncologist and follow what he says. And then, you know, always use an informative approach. I think it's really important that the left hand and the right hand know what's going on. I think it's really important that you tell your doctor if you're taking any supplements, what's going on. I think a lot of patients, you know, a lot of patients just are searching the internet and trying to find different things. And sometimes they're afraid to talk to their doctor about what they might take because they found something on the internet that said this or that. But I think the most important thing is communication and informing your oncologist of, you know, what your plan is and getting it approved. Also, you know, I want to be clear that the holistic, you know, therapy and integrative oncology is not alternative therapy. So we're big proponents of integrative oncology, but not necessarily alternative therapy. I know that might rub some people the wrong way, but, you know, just working as a nurse in oncology for 10 years, I really saw the difference between, you know, integrative oncology and patients that did alternative therapy. And maybe we saw the alternative therapy people that rejected the, you know, traditional oncology methodology kind of come to us in rough shape. And there was, you know, a lot of damage that we just had to try to heal. But that's my biggest thing is communication between your naturopath and your oncologist and informing exactly what's going on and a lot of communication and transparency.
Certainly, yes, that's really great insight. It's really important to collaborate with the healthcare provider that you're working with. I mean, if you're putting in trust to a doctor to help support your well-being, that is a really important first step. And I think adding methods to help balance, like you both mentioned, yoga, mindfulness, meditation, your creams, different things like that to help support and ease the process. I think that is a really great approach for people that really need that level of support. So thank you so much, both of you, for your insights. I'd love to open it up to some time for questions from the audience. So I am going to tune in right here to see if there are any questions currently from our audience. Okay, a question coming in, I think from our site. How do you address skepticism from patients or healthcare providers who might be hesitant about integrative or holistic approaches with traditional cancer treatments?
I can take that if you want, Mark. I think that, you know, part of the reason physicians and everybody is a little leery is the standard in science is a double-blind placebo study. That's exactly why we haven't done a clinical trial. But I think that if you really want to start searching the web for answers, I highly recommend going to PubMed. I think that's a really reliable source of information, including that statistic I gave about the better outcomes, the 95% better outcome from a 2020 study. So doing a little bit of research, but being really checking the source of where you're getting your information to make sure that it's really a reliable source that's being utilized. And you don't have to have a subscription to go on to PubMed and get information. And so that's what I would highly recommend, because once you see what people are seeing in this space, you can feel more comfortable utilizing the modalities and methodologies that are there.
Certainly.
I'd just like to piggyback on that a little bit. Just remember your nurses, they're your best advocate. So if you want to do some integrative holistic therapy, talk to your nurses, and your nurse can really bridge that gap between you and your doctor. So your nurses, they're going to be your biggest advocate when you want to go and integrate some of that stuff.
Awesome, I love that. Do your research through medical peer-reviewed articles and talk to your nurses who are your biggest advocates. Amazing, thank you both. Another question here. Do you think environmental factors and lifestyle or any other external influences are the biggest contributors to the rise of cancer currently? And how can patients mitigate this risk?
Well, again, I think that's, there's a lot of anecdotal information out there, but I think the easiest example I always give and use is something that's in our world today. So you can still go out and purchase Roundup. We know it's a carcinogen. They're already paying damages to people with bloodborne cancers like leukemia and lymphoma. So I think you just want to be an educated consumer, read the labels. I'm a big fan of if you don't know how to pronounce it, you probably shouldn't be putting it in your body. So, it's, again, you just have to be an informed consumer and practice some good due diligence.
Certainly, I can agree with that, and we've talked about this in some past episodes of MB News, and I talk about it with my clients and my friends all the time that are in this holistic health space, that it's so crazy that we live in a society, in a world where there's so many chemical products that are not really regulated, from beauty products to gardening products like you mentioned, to creams, to whatever else, food, even things that we put into our body, dyes, our clothes. I'm just always so shocked at all of the things that are out there that are causing harm, even if it's just at a minuscule level. All of that adds up. So just from like a consumer and from a media perspective, definitely don't believe everything that you see online. Like if you see a commercial and you see a bunch of happy people drinking, I don't know, like a certain type of beer or a certain type of soda, don't think that that's gonna add value to your life by drinking it. And definitely don't just follow the mainstream. Read the labels, as Lesley mentioned, and make sure that things have less ingredients. Stick to eating whole foods, washing your vegetables, shopping at your local grocery store, and then buying as clean products as you possibly can. I mean, I know there's a lot of greenwashing out there with people saying, or brands saying, this product is clean and organic and natural, but these are just all buzzwords. And anyway, we definitely went into more detail on that in another episode of MB News. So if you'd like, go back to one of go back in our channel and watch that episode. Let's see. And the last question, Mark, you had something you wanted to add?
Yeah, there's some really cool apps out there that you can actually just scan the barcode and it'll give you the list of all the ingredients and whether it's like bad, good, or terrible. So it's like a lot easier now that you can just use technology to scan barcodes and understand what this product is and how it might impact your health.
Yeah, certainly. I've seen some of those apps. That's great. Great advice. Thank you so much, Mark. I'm going to take one more question because we are here at 8:30 p.m. So the last question that I'd like to share is, how does diet play a role in both cancer prevention and recovery? And are there any specific foods or nutritional strategies that you recommend?
Well, one of the things that I do know is you can have a lot of sensitivity to tastes or smells when you're going through treatment, particularly chemotherapy. So you want to make sure that you're keeping enough calories. And to be honest, because of the problems with not always feeling great, I think the most important thing to do is to make sure that you're getting some calories in, even if they're not the best, whatever you're craving or able to tolerate. I think is what you should do. I definitely think that you want to minimize things that create inflammation like sugar. And we could do a whole separate show on all of that. So I think I'll keep it simple, but I mean, you need to eat. And so you want to eat what you can tolerate. And then my other really important piece of advice is don't eat things that you really, really love during cancer treatment, because you can create these connections and then you'll never be able to eat it again. So I can never eat eel ever again on sushi because it was destroyed for me. It tastes like I'm chewing on a tin can now. So if you really love something, even if you have a hankering for it, you'll create this connection in your mind between that food and the chemotherapy experience and maybe some nausea. So I would avoid your favorite foods.
Wow, that's really interesting. I didn't know that. Thank you so much. Thank you both. We are now coming to a close on this episode of MB News, and a special thanks to the Mindful Body Productions team for making this all happen. And I also want to thank our speakers for sharing your expertise. Thank you, Lesley. Thank you, Mark. I'm so happy to have you here. And lastly, I want to thank the audience for being here, because by bringing awareness to these issues, this is where we as consumers can vote with our dollar and advocate for change. So please join our next live on April 2nd for Stress Awareness Month. We will be speaking on stress management for high-paced medical professionals and practical techniques to improve performance and well-being. So please sign up to our list by following the link below, and you can also scan the QR code so that you can stay updated. Thank you, everybody. Have a great evening.